You're in the moment. Everything's going perfectly. And then, it happens. You lose your erection halfway through. The embarrassment. The frustration. The silent panic in your partner's eyes wondering if it's something they did wrong. Here's what most men don't know. Losing your erection during sex isn't always about low testosterone or serious medical conditions. Sometimes, it's about 7 simple things that are sabotaging your performance right now. And today, I'm going to show you exactly how to fix them. My name is Sophie Brooke, a board-certified urologist, and in my practice, I see dozens of men every month who struggle with maintaining erections during intercourse. And you know what? Most of them think they need expensive treatments or medications when the solution is often much simpler. In the next few minutes, I'm going to share 7 fast fixes that can help you stay hard all the way through. These aren't gimmicks or quick tricks. These are evidence-based strategies that address the real physiological and psychological factors affecting your performance. Let's dive in. Fix number 1, the breath that's killing your hardness. Here's something that might surprise you. The way you breathe during sex directly affects your ability to maintain an erection. Let me tell you about James, a 34-year-old patient who came to my office convinced he had erectile dysfunction. After running tests, his testosterone was normal. His blood flow was fine. Everything checked out physically. Then I asked him one simple question. What happens to your breathing when you're having sex? He paused. I guess I hold my breath a lot when I'm concentrating. And there it was. When you hold your breath or breathe shallowly during sex, you trigger your sympathetic nervous system, the same system that activates your fight or flight response. This constricts blood vessels and diverts blood away from your penis. The fix is simple. Focus on slow, deep belly breathing throughout sex. Breathe in through your nose for 4 counts, out through your mouth for 6 counts. This activates your parasympathetic nervous system, which promotes blood flow to your genitals and helps you maintain your erection. James practiced this for 2 weeks. He reported back that his erections were stronger and lasted longer without any medication, just by changing how he breathed. Fix number 2, the silent performance killer in your head. Spectatoring is a term sex therapists use to describe when you mentally step outside your body during sex to watch and judge your own performance. Michael, a 41-year-old executive, described it perfectly. It's like there's a commentator in my head saying, "Is it still hard? Is she enjoying this? What if I lose it?" This constant self-monitoring creates anxiety, and anxiety is erection's worst enemy. When you're anxious, your body releases adrenaline and cortisol, hormones that constrict blood vessels and make it nearly impossible to maintain an erection. Here's your fix. Use the sensory anchor technique. During sex, deliberately focus on one specific sensation at a time. The warmth of your partner's skin, the rhythm of your movements, the sound of their breathing. When your mind starts to wander to performance thoughts, gently redirect it back to that sensory anchor. You're not trying to force thoughts away. You're simply choosing where to place your attention. This technique rewires your brain to be present during sex rather than being stuck in your head, judging yourself. Fix number 3, the dinner mistake sabotaging your bedroom. Did you know that having a large meal within 2 hours of sex can significantly impact your ability to maintain an erection? Here's why. When you eat, especially a large or heavy meal, your body redirects blood flow to your digestive system to break down that food. That's blood that could be flowing to your penis. I had a patient, David, who noticed he'd lose his erection during morning sex after breakfast, but had no issues at night. We tracked his eating patterns, and sure enough, he was having a huge breakfast right before attempting morning intimacy. The solution: if you know sex is likely, eat lighter meals and give yourself at least 2 to 3 hours after eating before engaging in sexual activity. If you need to eat something closer to sex, opt for a small snack rather than a full meal. Also, avoid excessive alcohol. While 1 drink might reduce anxiety, more than 2 drinks impairs the neurological signals needed to maintain an erection. It's called whiskey dick for a reason. Your body can only prioritize so many functions at once. Give your erections the blood flow they need by timing your meals right. Fix number 4. The hidden muscles making you go soft. Most men have heard of Kegel exercises for women, but here's something few know. Your pelvic floor muscles play a crucial role in maintaining erections. These muscles, specifically the ischiocavernosus and bulbocavernosus muscles, help trap blood in your penis during an erection. When these muscles are weak, blood can leak out, causing you to lose your erection during sex. A study published in the British Journal of Urology found that 40% of men with erectile dysfunction regained normal function after just 3 months of pelvic floor exercises. Here's how to do them properly. First, identify the right muscles. Next time you urinate, try to stop the flow midstream. Those are your pelvic floor muscles. To exercise them, contract those muscles and hold for 5 seconds, then relax for 5 seconds. Do this 10 times, 3 times per day. You can do these anywhere, in your car, at your desk, watching TV. As you get stronger, increase the hold time to 10 seconds. Within 6 to 8 weeks, most men notice significantly stronger and more sustainable erections. Think of it as going to the gym for your penis. The muscles need training just like any other muscle in your body. Fix number 5. Why your favorite position is making you fail. This one's practical and often overlooked. Certain sexual positions make it much harder to maintain an erection because of how they affect blood flow and physical exertion. Robert, a 38-year-old patient, told me he consistently lost his erection in missionary position, but had no problems in other positions. The reason? He was bearing all his weight on his arms, tensing his entire body and restricting blood flow. Here's what to do. Choose positions that allow you to stay relaxed and don't require extreme physical exertion, especially when you're first working on maintaining your erection. Side-by-side positions are excellent because they require less effort and keep your body more relaxed. Having your partner on top can also help because it requires less exertion from you while maintaining good blood flow. Save the more physically demanding positions for when your confidence is higher and your erections are more reliable. Also, don't be afraid to switch positions mid-sex if you feel yourself losing hardness. Movement and change can actually help re-engage your arousal and restore your erection. Fix number 6. The screen that's ruining your real sex life. This is uncomfortable for many men to discuss, but it's critical. Excessive pornography use can make it harder to maintain erections during real sex. When you regularly watch porn, especially if you're using a tight grip during masturbation, you can condition your brain to respond to that specific, intense stimulation. Real sex can't compete with that level of stimulation, and your body struggles to maintain arousal. This is called porn-induced erectile dysfunction, and it's becoming increasingly common in younger men. The fix? Take a break from pornography for at least 60 to 90 days. This allows your brain to reset its arousal patterns. During this time, if you masturbate, use a light grip and focus on sensation rather than visual stimulation. Many of my patients report that after this reset period, their erections during partnered sex become significantly stronger and more reliable. Your brain is incredibly adaptable. Give it the right environment, and it will recalibrate. Fix number 7. The perfection trap destroying your performance. Here's the final fix, and it might be the most important. Stop trying to maintain 100% hardness throughout the entire sexual encounter. Many men panic the moment they notice any softening, which creates anxiety, which causes more softening, creating a vicious cycle. Here's the truth that most men don't realize. It's completely normal for erections to fluctuate during sex. You don't need to be rock hard every single second. Apply the 70% rule. As long as you're at about 70% hardness, penetration is possible and sex can continue. When you feel yourself softening slightly, don't panic. Keep stimulating yourself or have your partner stimulate you, and the hardness will return. This mental shift alone has transformed the sex lives of countless patients. When you stop demanding perfection from your body, the pressure dissolves, and ironically, your erections become more consistent. Your penis is not a machine. It's part of a complex biological system influenced by your thoughts, emotions, and physical state. Treat it with patience rather than pressure. Start implementing these today. You don't need to do all 7 at once. Pick 2 or 3 that resonate most with you and focus on those first. Remember, if you've tried these strategies and you're still struggling with maintaining erections, it's time to see a urologist. There could be underlying cardiovascular issues, hormonal imbalances, or other medical factors that need professional evaluation. But for most men, these simple fixes can make a dramatic difference. Your sex life doesn't have to be defined by frustration and embarrassment. Take action today. If this video helped you, hit that like button and subscribe for more evidence-based men's health content. And drop a comment below letting me know which fix you're going to try first. Stay hard, stay confident,